Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 3. Environmental Emergencies. Burn. Burns is one of the most devastating experiences that a human individual could ever have, especially in cases of severe burns. It affects the physiologic, psychologic, social, economic, and spiritual aspects of a person's life. Severe burns cause profound alteration in the body image of a person. Moreover, contracture, deformities, and scarring may greatly impair functioning of different body parts. Fluid-electrolyte, acid-base imbalances commonly accompany burns. Severe imbalances may result in death. Burns may be classified according to causes as follows: thermal burn, due to hot objects or substances; chemical burn, due to strong acids or alkali; electrical burn, due to electrical sources, electrical appliances; and radiation, due to excessive exposure to sunlight. Burns may be classified according to depth of skin involved as follows: 1st degree, 2nd degree, 3rd degree, and 4th degree. 1st degree or superficial thickness burn. It involves the epidermis, usually reddish intact skin, and painful. 2nd degree or superficial partial thickness burn. It involves the dermis, with moist surface, with blisters, and painful. 3rd degree or deep partial thickness. It involves the subcutaneous layer, usually pearly white, with no pain. 4th degree or full thickness burn. It involves the muscles and bones, usually blackish or charred, with no pain. The stages of burns. The stages of burns are the following: 1. Shock phase or fluid accumulation phase or emergent phase. 2. Diuretic or fluid remobilization phase. And 3. Recovery stage. 1. The first stage of burns is called shock phase or fluid accumulation phase or emergent phase. It occurs during the first 48 hours post-burns. The fluid shifts from intravascular compartment to interstitial compartment. This leads to generalized dehydration. Hypovolemia occurs due to plasma loss. This causes decreased cardiac output and fall of blood pressure. There is hemaconcentration and an increased hematocrit. Because plasma is lost into the interstitial compartment, there is oliguria. This is due to decreased renal tissue perfusion, decreased release of antidiuretic hormone and aldosterone. These are body's responses to hypovolemia. Hyperkalemia and hyponatremia also occurs. This results from release of potassium from damaged cells. Sodium is trapped in the edema fluids, or in the interstitial compartment. Metabolic acidosis. This results from accumulation of metabolites, hyponatremia, and hyperkalemia. Primarily, it is due to hyponatremia, since sodium is unavailable, because it is trapped in the edema fluids or interstitial compartment. Bicarbonate produced by the kidney will be excreted. 2. The second stage of burns is called diuretic or fluid remobilization phase. This occurs after 48 hours post-burns. The fluid shifts from interstitial compartment to intravascular compartment. Hypovolemia, hemodilution, and decreased hematocrit occur. This is due to fluid shift from interstitial compartment to intravascular compartment. There is diuresis. This is due to increased renal tissue perfusion, decreased antidiuretic hormone and aldosterone secretion. Hyperkalemia, hyponatremia occurs because potassium moves back into the cells and sodium is still trapped in the edema fluids or in the interstitial compartment. Metabolic acidosis occurs due to decreased sodium levels cause secretion of bicarbonate by the kidneys. And 3. The third stage of burns is recovery stage. This occurs on the 5th day onwards. The following problems occur during this time: hypocalcemia. This results from loss of calcium in the exudates. It is also due to utilization of calcium in the granulation tissue or scar formation in the areas of burns. Next is negative nitrogen balance. In stress-like burns, there is increased protein catabolism. Protein demands are increased for healing, and protein intake may be inadequate. And lastly, hypokalemia. Potassium has shifted back into the cells. Serum levels are decreased. The first aid interventions for burns are as follows. Stop the burning process by, first is to immerse the affected part in cold water, followed by drop and roll. Advise the client to drop and roll on the ground if clothing is in flame. And lastly, throw a blanket over the client to extinguish the flame. This cuts off source of oxygen from the environment and the flame will spontaneously be extinguished. The priority actions in case of fire are as follows. We will use the mnemonic race. R. Remove the client. A. Activate the fire alarm. C. Confine the fire. And E. Extinguish the fire. To use the fire extinguisher, do the following. We will use the mnemonic pass. P. Pull the pin. A. Aim at the base of the flame. S. Squeeze the handle. And S. Sweep from side to side. Collaborative management. Collaborative management for clients with burns includes the following. 1. Promote respiratory function. 2. Promote fluid-electrolyte and acid-base balance. 3. Relieve pain. 4. Prevent infection. 5. Maintain adequate nutrition. 6. Provide wound care. 7. Promote gastrointestinal support. 8. Fluid replacement. And 9. Rehabilitation. 1. Promote respiratory function. Assess for city sputum and singed hair in the nose and eyebrows. Singed hair is stiff and rigid burned hair. 2. Promote fluid-electrolyte and acid-base balance. Assess the following parameters. Vital signs. Urine output. Central venous pressure, CVP, level of consciousness, weight, percentage of burns. The vital changes in dehydration are as follows. Weight loss, decreased urine output, decreased CVP, decreased level of consciousness. Changes in vital signs are as follows. Elevated body temperature, increased pulse rate, rapid respiratory rate and low blood pressure. The rule of nines for determining percentage of burns in an adult. Forehead, face, neck is 9%. Anterior trunk is 18%. Posterior trunk is 18%. Upper extremities is 9% each. Lower extremities is 18% each. And foregenital is 1%. Three. Relieve pain. Administer morphine sulfate per intravenous as prescribed. Monitor the client for respiratory depression. Have Narcan, naloxone, readily available. This is the antidote of narcotics. If respiratory depression occurs, use bed cradle to relieve pressure from the top sheet and to prevent sticking of exudates to the top sheet. Avoid exposure of affected areas to draft. Sudden gush of wind causes hypersensitivity of exposed nerve endings. Close the door of the client's room. Please click the next button for part 2. Thank you for listening. Have a good day and be safe. Agyamanag.